Hi, my name is Dan, and I'm a mental health pharmacist, and today I wanted to make a video about why we use stimulants to help with hyperactivity in ADHD. This is a counterintuitive treatment because it would seem that stimulants may worsen hyperactivity in ADHD, but they're typically used to treat that. First, I wanted to start with some background. Attention deficit slash hyperactivity disorder, shortened to ADHD, is a neurodevelopmental disorder characterized by inattention, disorganization, hyperactivity, and impulsivity. It is considered a neurodevelopmental disorder because the onset is typically during or before grade school, during the developmental years. To receive a formal diagnosis of ADHD, there must be 6 symptoms at least of inattention and/or 6 symptoms of hyperactivity. Some symptoms must be present before 12 years of age, and the symptoms must occur in at least 2 settings, for example, at school and at home. And the reason that the 2 settings is in place is if the symptoms just occur at school, there might be some other issue such as bullying to look into. Finally, to be considered a disorder, the symptoms must be severe enough to interfere with functioning. The history of ADHD is quite interesting. The American Psychiatric Association released the first manual for diagnosing mental illnesses in 1952. This manual, called the DSM, did not include ADHD. In 1968, an updated version was released that contained a condition called hyperkinetic reaction of childhood. Hyperkinetic reaction of childhood was characterized by overactivity, restlessness, and short attention span. So it was essentially a precursor to ADHD. The third edition, released in 1980, contained ADD, Attention Deficit Disorder. ADD had 2 subtypes, ADD with hyperactivity and ADD without hyperactivity. Finally, in 1987, things were simplified when an updated version was released that changed the name to Attention Deficit slash Hyperactivity Disorder. Interestingly, many people still call the condition ADD, even though the formal name was changed to ADHD, which accounts for both inattention and hyperactivity, over 30 years ago. The recommended treatment for ADHD depends on the age of the patient. For a patient aged 5 to 6, the recommendation is for behavioral therapy and/or parental training. For age 6 to 12, an FDA-approved medication along with behavioral therapy is recommended. For age 12 plus, an FDA-approved medication along with a recommendation for behavioral therapy is recommended. And finally, for adults, a psychostimulant such as methylphenidate or an amphetamine product is recommended, unless the patient has a history of a substance use disorder. Many stimulant products are available. Most are either a methylphenidate product or a methylphenidate derivative like dexmethylphenidate, or an amphetamine product or an amphetamine derivative like dextroamphetamine or lisdexamphetamine. Additional treatments exist, and they include norepinephrine reuptake inhibitors like atomoxetine and alpha-2 agonists like clonidine and guanfacine. The benefits of these final medications is that they are not controlled substances and they are not addicting like stimulants have the potential to be. So why are stimulants used to treat hyperactivity? Wouldn't this make it worse? Stimulant medications block the reuptake of dopamine and norepinephrine, which are neurotransmitters in your brain. So once these neurotransmitters are released, they stay in the synapse for longer, which is the space between brain cells, and have a greater chance to exert their effect. Too much dopamine and norepinephrine can in fact cause excessive energy, heart rate changes, anxiety, and just an overall stimulation. But the cause of hyperactivity in people with ADHD is not too much dopamine and norepinephrine. It is a dysregulation of dopamine and norepinephrine. At baseline, your brain is releasing small amounts of dopamine and norepinephrine all the time. This is called the tonic release. In someone with ADHD, the tonic release is decreased, so very little is released. This can lead to inattention because you need parts of your brain to be stimulated to pay attention. Since very little is released at baseline, this leads to a buildup of neurotransmitters in the brain cells, so when the phasic release finally comes, it's a floodgate, a sudden flood of norepinephrine and dopamine, which causes the impulsivity and the hyperactivity. When a stimulant medication is given to someone with ADHD, it prevents the reuptake of dopamine and norepinephrine or increases the release of dopamine and norepinephrine. So the tonic phase is effectively larger, which treats inattention. And the phasic release is effectively smaller, which treats impulsivity and hyperactivity. So a stimulant medication alters the tonic phase by making it larger, and the phasic phase by making it smaller to treat both sides of the attention, the inattention, and the hyperactivity. Many fear stimulant use because of their abuse potential. While these medications can be abused, when they are used properly, they actually decrease substance use disorders. For example, low-dose methylphenidate increases dopamine more in the prefrontal cortex, which helps with ADHD symptoms, as compared to increasing dopamine in the nucleus accumbens, which is part of the pleasure pathway and can cause euphoria in some of the addicting effects and lead to substance use disorders. When used properly in patients with ADHD, stimulants decrease the risk of substance use disorder. In fact, untreated ADHD is a risk factor for the development of a substance use disorder. In individuals with ADHD, stimulant medication use was associated with a 31% decrease in the development of a substance use disorder. A study in adolescents found that earlier treatment with stimulants and a longer duration of treatment with stimulants were associated with fewer substance use behaviors in late adolescence. In summary, attention deficit / hyperactivity disorder, or ADHD, is a neurodevelopmental disorder characterized by symptoms of inattention and/or hyperactivity. They may be treated with stimulant medications, not because the goal is to provide more stimulation, but the goal is to regulate the dopamine and norepinephrine in the brain. So I hope this video was helpful in explaining a little bit about ADHD and why stimulants don't make people with ADHD feel more stimulated. Thank you so much for watching.